Well, Niall Dickson is Chief Executive of the NHS Confederation, which represents all those that plan, commission and provide health services. Niall Dickson, in a sense, I suppose, it's a bit of a rebuke for the people you represent.
No, I don't see it as a rebuke at all. The fact is that the health service has suffered catastrophic reduction in funding over this period compared with the demands that are being made upon it. So in a way, it's quite remarkable that these levels of satisfaction remained as high as they did. I think it's also worth pointing out that among those in this very good and robust survey, among those who actually had contact with service, it was much higher. I think that one of the reasons why GP figure is higher than some of the others is because most people have had a contact with their general practitioner. If you looked at inpatient services, it's as high as 83% among people who've had treatment in the last year. So I think the service is still doing well, but I think the general dissatisfaction is an honest reflection by the public of the kind of pressures which staff are feeling, the amount of time people have to wait, and a sense that the service itself is struggling, and it is struggling to meet many of the standards which we've set it, and it's struggling because it hasn't had the funding. Now, to be fair to the government, they have announced very significant extra funding from April, from next month, as it were, going forward for the next 5 years. It's not a king's ransom, but it is a lot more than we've experienced over the last decade.
It's interesting the point you make about the difference between people who have direct experience and those who have a general view. But and this problem has been pointed out before. People will say my individual experience was brilliant. My mum was well treated. We, for example, heard from that lady in the report there. But I don't think the NHS is good enough for this reason or that reason. But those people are also out-funded as taxpayers, and you've got to keep all those people believing in it, haven't you? So in a sense, these attitudes, even if they're not just patients, do matter.
I totally agree. They do matter, and they reflect a reality. Among GPs, it's a reality, again, as highlighted in Hugh's report, the fact that people feel rushed going in and out of their general practitioner. And that's not because GPs want only to give them short consultations. It's because of the kind of pressure that they're under now. The reality is that if you look historically, the health service had around 3.5% real terms funding every year above inflation. That was how it averaged out until around the year 2000. Then for the first 9 years of this decade, it got extraordinarily extra funding over that period. But since then, we've actually seen this period of austerity where we haven't just gone back to where it was for the first 50 or 60 years of the NHS. We've had an unprecedented period where we have not matched anything like the increase in demand over that period. And what we're now doing, hopefully going back to at least the kind of run rate which we saw up until the year 2000.
My eye can't help being drawn to the figure who appears to be on the bookshelf behind you. It looks like it might be Jeremy Hunt, the longest serving Secretary of State for Health. Whether it is or not, what should his successor be doing in the battles ahead with the Treasury over funding?
Well, I think there are two battles to be fought. One is the health service story. I mean, they always say, you know, with the Treasury, would you buy a used car from these people? Because they said it was a 3.4% increase, which, you know, is around the run rate that you might expect going forward. But actually, of course, it was only a bit of the health service. It didn't cover public health. It didn't cover capital funding, and it didn't cover education and training. So those bits were excluded, and they're still a fight in terms of the spending review coming up. But perhaps as crucial, or even more crucial than that, it didn't cover social care, and there's real concern within the health service now that the social care funding, which has been worse than the health service over this period, and indeed previous governments didn't fund it adequately either. This government and the Prime Minister has promised to do something about it. We really need, and the Secretary of State needs to put pressure on the Chancellor and on the Prime Minister to answer the promises they've made, which is sort out social care. And that doesn't mean a one-year funding settlement. It means putting it on a parity of esteem with the NHS. And that's the NHS saying this, not social care. NHS is saying we can't deliver unless you sort out the social care problem.
Niall Dickson, thank you very much. Just before you go, satisfy my curiosity, is that a souvenir, Jeremy Hunt?
I'd have to turn round and have a look at one you're referring to.
Just above your eye line.
It is. It is in fact, there's every other Secretary of State inside here. So if you'll find that.
So somewhere in there is Nye Bevan and Andrew Lansley.
I could. Nye Bevan is sitting in there somewhere.
You could definitely set out a fashion for that one. You're going to need an even bigger Matt Hancock. Niall Dickson, thank you so much. Pleasure to speak to you as always. Niall Dickson there at the NHS.